Hello, everyone, and welcome. Thank you for joining tonight for the VMC Animal Health Education Series. We're grateful to have you here, and on behalf of our team, I would like to welcome you to tonight's presentation. My name is Scott Horsfall, and I partner with clients and clinicians at the Veterinary Medical Center to serve animals and their families. The VMC Animal Health Education Series features our leading experts covering a variety of topics in veterinary medicine, ranging from relevant health information for your beloved pets to ways that we're advancing clinical research that will serve dogs, cats, and people for generations to come. During the presentation, you can use the Q&A function in Zoom to ask questions. We also ask for pre-submitted questions, and we'll do our best to cover the themes that came up the most frequently during the final portion of the presentation. Please note that if your question for tonight's presentation relates to your pet's specific medical care, it is best to call the VMC directly or have your primary care veterinarian contact our team for a consultation so that we can best serve your family. With that, I'd like to introduce our speaker for tonight, Dr. Sandra Koch. Dr. Koch is a professor in the Veterinary Clinical Sciences Department of the College of Veterinary Medicine at the University of Minnesota and a clinician in the Dermatology Department at the Veterinary Medical Center. She received her DVM degree from a university in Brazil and has a Master of Science degree in canine allergies from the University of Minnesota. Dr. Koch is a diplomat with the American College of Veterinary Dermatology. We're grateful to have Dr. Koch with us tonight to discuss common dermatological conditions in dogs. With that, I'll hand it over to Dr. Koch.
Thank you so much, Scott, for the nice introduction. Hello, everyone. This is wonderful. I'm very grateful for being here tonight with so many of you. I just regret that we can't be in person. I'd love to see your faces, to connect in person and see your smiles. But that's where we are. I hope you're all doing well and that you enjoyed this presentation, and I'm happy to answer questions at the end. I'm going to start sharing my screen here. We see a lot of dermatological problems as dermatologists, and I just chose a few of the common problems that we see in dogs to go over with you today. But before that, I would like to go over a little bit of who we are, just talk to you about what a veterinary dermatologist do. And it's kind of interesting because some people that own dogs and cats don't know that veterinary dermatologist is a thing. And we are a small number of people at the United States. We're a small group. We're all passionate about skin diseases. And what we do, we go through a training after we go through veterinary school. And we either pursue a one-year internship or at least 2 years of general practice in veterinary medicine, and then go on to do a 2-year or 3-year residency program. Then we take an exam by the College of Veterinary Dermatology, and if we pass, we become board certified, and we exclusively work with dermatology. Similar to people, we take care of skin problems and related to various causes. The skin is the largest organ of a dog or of an animal, of a mammal, and because of that, it can reflect a lot of problems. And I tend to say that the skin is the mirror of our soul, because it can be affected by many issues, health issues. Even if you don't feel well, your skin can suffer. And the same thing with animals. We treat a variety of conditions, from hair loss that can be just cosmetic, just like in people, to severe itching, to tumors. We also take care of problems associated with the ears in humans. They have a specialty for that. In veterinary medicine is a dermatologist that take care of ear problems. We also take care of anal gland issues, problems with areas of the body like the eyelids, the mouth, and many different areas of the skin. And you may be seeing us because you wanted to, you have a problem with your pet and you'd like us dermatologists to evaluate. We do take self-referrals at the University of Minnesota, but also we may be seeing your pet because your veterinarian recommended, referred for, because it has been a more complicated problem or is a rare condition that needs our help. So with that, I'd like to start with this short video. I hope it works well for you guys. Some of you might have a pet at home that experiences severe itching, and chewing is one of them. So can you imagine being with this animal constant? Was just in the exam room and constantly chewing, even when we told him to stop. So this causes a lot of problems with your quality of life and also with your own quality of life. If the pet is sleeping in your bed and it's itchy, then it wakes up the family as well. So it affects everybody. The most common cause of itching in dogs that we see is allergies. Often I call myself an allergist because this is the most common condition we see in our practice. And when we think of allergies, we should think of an inherited condition. So it's genetic. And because of that, when we diagnose a dog with allergies, we recommend not breeding. There is a potential for the offspring to develop allergies as well, and we don't want to disseminate that if possible. What is allergies? Allergies is an excessive immune response against things that normally people that don't have allergies don't react, right? Like things in the environment and food allergens. And when we think of itching, we think of scratching. But when I showed you the video, that dog was chewing, and that's an allergic dog. So chewing, licking, rubbing, biting, and rolling can also be signs of allergies or that something is wrong with the animal. And that is the hallmark of allergic disease. If the patient is itching, it's one of the thoughts that we have is that it could be an allergic process. Most commonly, we have red skin due to inflammation, hair loss, and scratch marks and sores, and that's all because of the itching. So the first symptom that you notice is itching, and from there, due to self-trauma, you start seeing more problems such as inflammation and hair loss and shedding. They are commonly affected by skin and ear infections, which are secondary. They're caused by the constant trauma to the skin and the abnormal barrier, the lack of protection of the skin in these allergic animals. Now, when you think of allergies, automatically we think of respiratory signs, right? We think of sneezing and coughing and red eyes. And dogs certainly can have that, but it's not as common. It's much more common, the skin aspect of it. So the large majority of dogs with allergies will not have any of those signs that humans have. So let's talk about each of these common type of allergies a little bit more, including environmental allergy, food allergy, flea bite allergy. For environmental allergy, also called atopic dermatitis, or some people call it as atopy, this is a common disease and more commonly affects young adults. But more and more, we're seeing young puppies and older adults affected with allergies as well. There are many predisposed breeds, and even if I didn't list here, it's probably still predisposed. Terriers are a very common one. Spaniels, English Bulldog, Goldens and Labrador Retrievers, German Shepherds, the list goes on. And you may be thinking, well, it's just purebred dogs? No, actually, we also see allergies, environmental allergies in dogs that are mixed breeds as well. This condition can be seasonal or year-round. Seasonal would be more like just spring and summer, or year-round, unfortunately, the animal would suffer the entire time throughout the year. Some dogs have mild symptoms. They itch a little bit. It's not even enough for clients to think that there is a concern. Others have a more moderate symptom, and others are constantly suffering from allergies. So what are these environmental allergies that I'm referring to? They're just the same things that humans are allergic to. House dust mites and storage mites are big ones. They're these tiny little microscopic creatures that in this picture looks horrifying. And they are in the house. They're in the house dust. They are in the environment. And they're the most common cause of allergies in humans and also in dogs, and also in cats. So it's a very common allergenic cause in mammals. Pollens is another big one. Just like people, dogs can be allergic to trees, pollens, grass pollens, and weed pollens. It's not uncommon to see a dog that is very, very itchy during the late summer to early fall season, and then we find out that that dog later is affected by ragweed allergies, just like people. They can also be allergic to molds, indoors and outdoors. Spring and fall bring a lot of moist outdoors, and that can also lead to allergies to mold or symptoms of allergies to mold. They can also be allergic to feathers, to other household things like wool and cotton, and they can also be allergic to other species, including cats, humans, and dogs. So that's similar to people as well. The problem is they're often not allergic just to one thing. They can be allergic to a lot of these things all at once, making it even harder for us to manage their allergies. What does this look like? What environmental allergy can look like? As I mentioned before, you can have hair loss in red skin, like you see in these pictures. Face is commonly affected, like around the muzzle, around the eyes. They can be itching their eyes, even though they are not necessarily sneezing and coughing. Their ears are commonly affected as well. And over time, they can lose all their hair and the skin gets a lot of sores. Besides the face and the ears, the ventral part of the body, the bottom part of the body, like the belly, the groin, the armpits, the neck, those are commonly affected. And it's not a surprise because those are the areas that the animal is in contact with all those allergens that are on the ground. And it's very classical for allergies to have this distribution of signs: face, belly, groin, armpits, and neck. Paws are also commonly affected. And you may see your dog chewing and licking the paws all the time, or the nails. When you look, they have sores or redness and hair loss in between the toes and pads. You can also see in this picture very red and swollen and almost no hair. That's all due to self-trauma, the constant chewing, licking, biting of the animal on their own skin. And they can also cause symptoms that affect the entire body, like in this case with hair loss and sores and severe itching. This little guy used to be a Sharpie looking. Unfortunately, allergies really made him miserable and lost all the hair, almost all the hair. So I wanted to tell you, how do we diagnose allergies? And this is the biggest challenge of our lives for dermatologists because there's no effective diagnostic tests. Even in humans, these tests that we do are not 100% sensitive, are not 100% reliable or specific. So how do we diagnose environmental allergies? We rely on the history, a very detailed history about the patient's life and the environment. We rely on the clinical presentation, where they're itching, how they look, and most importantly, on the exclusion of other diseases that mimic allergies, environmental allergies. And that is a challenge because you can't tell many times these diseases apart by the way they look, including food allergy, flea bite allergy, and sarcoptic mange. So it's a challenge, but it requires experience and knowledge about allergies in order to give a proper diagnosis. You might be thinking, how about allergy skin test? You know, my doctor has tested me, or you have heard about it for dogs and cats. Absolutely, we test animals with allergy skin test as well. We refer to them as intradermal test. And what do? We give a light reversible sedation. We shave the side of the chest, and we inject 60 different allergens. The number of tests differ according to different dermatologists. But this includes all those pollens and house dust mites, different allergens that are important in Minnesota. And once we have these strong reactions, like showing here, red and round and raised compared to positive and negative control, we do give a positive result. And based on this, usually within 15 minutes, we have the results. You can see here few reactions compared to here. This dog reacted to almost everything. It's like I joke that I'm allergic to life. This dog is allergic to life, has allergies to everything. And what do? Definitely, we use this test to support our diagnosis of environmental allergies, but we don't rely on this test alone. And why is that? You can have a dog that is completely healthy with a positive test results, and a dog that is allergic with negative test results. So this test supports my diagnosis, but do you know why the main reason we do them? With the purpose to treat these animals, to perform what we call allergy-specific immunotherapy, and we have that in form of shots or oral drops. I love this therapy because it's a kind of a natural therapy, right? So what we do for this dog that reacted to, let's say, several pollens and modes and house dust mites, we're going to include those allergens in a vial and slowly administer that to the animal to become desensitized or resistant to those allergens and hopefully lead a normal life. I'll talk a little bit about immunotherapy in a minute. As far as treatment, that's the part that is hard. It is what I call an impossible mission for some of these patients. Unfortunately, it can be very, very difficult to control allergy symptoms. And the biggest challenge is because we cannot get rid of the allergens, right? You may say, well, my dog is allergic to birch trees, and I have a birch tree in the backyard. Should I cut it off? Well, pollens they go large distance through the wind, and then you get rid of your beautiful tree, but you go to the neighbor or the park, or the pollens just come to you. So it's not something we can get rid of. If the dog is only allergic to wool, potentially you can, right? However, most of the time they're not allergic to only one thing, and that's unfortunate. So then avoidance, we try to limit the exposure. If you have a dog that's allergic to house dust mites, we give instructions on more frequent vacuuming and cleaning and washing, bedding, etc. But again, we're not going to get rid of those mites. So then what do? First of all, I want you to know that treatment for allergies, particularly environmental allergies, is not one size fits all. It's a specific customized treatment approach. What works for one pet may not work for the other. What one may be tolerating the medication, the other may not tolerate the medication. So we tailor to the patient needs. And some patients need more aggressive therapies, while others need more conservative therapies. And it's going to depend on a lot of factors. Does the pet have other problems, other concurrent diseases that may affect how I treat? But generally, bats, we recommend medicated bats, usually on a weekly basis. It helps remove the allergens. It helps control itching and treat secondary infections. We often use a lot of antimicrobials like mousse and wipes, ointments that may contain steroids and antimicrobials. Antihistamines, a lot of people give antihistamine to their pets, and they don't tend to be great at controlling allergies unless it's a very mild allergy. Antihistamines like Benadryl and Zyrtec can be used. They're better at preventing a flare than treating after that occur. So if you know summer's coming, starting the antihistamine ahead of time might make a bigger difference than giving after the symptoms of allergies are bad. It does cause some sedation, and some of the dogs will sleep better with antihistamine on board. Fish oil, they're also similar to antihistamine. They're not highly effective, but it can be a nice supplement to improve reduce inflammation, improve hair quality, and control itching. But by themselves, they don't do a whole lot. And they can take up to 12 weeks to work, so you have to do a long trial before you start seeing some benefits. Or steroids, you probably heard of it. If you have a dog with allergies, that dog must have been on steroids. Steroids such as prednisone is a common treatment, is an old treatment, and there's still a place for it today. I love steroids, but I also have a bad relationship with steroids because yes, it works wonderful. It works fast to reduce itching and inflammation, but it can have side effects, particularly if it's not used properly or at higher doses for long term. But some patients, we keep them on long-term steroids because that's the best option for those patients, as long as we give a low maintenance dose and they tolerate and they have good lab work results. But we also have those specific, more targeted therapy. One of the old ones that I talked about is allergy-specific immunotherapy that is available in the injection form that we teach our owners how to give at home if they prefer. They're given under the skin, like an insulin injection. Or we also now have oral drops, immunotherapy in the form of drops. They're usually sweet. Dogs tolerate it very well. This therapy doesn't always work, and I do prefer to start in younger patients. So if you have an allergic dog, it's better to do allergy testing and start immunotherapy sooner than later. I think they respond better. And the goal is to hopefully get them to tolerate those allergens and not need all those other drugs. Next, we have Atopica, and then more recently, Apoquel and Cytopoint. Those are wonderful treatment for allergies because although they also have some immunosuppressive effects, they're better tolerated in general than steroids. Cyclosporin can take a while to work, but Apoquel works very quickly. So those are all in the forms of pills. And Cytopoint. Cytopoint is a monoclonal antibody, which is not a drug per se. It's a biologic, and is very specific for a substance called IL-31 that causes itching in dogs with allergies. And is an injection that is given at the vet clinic, and most dogs need monthly injections. And it works wonderful, works quickly in the majority of the patients. And so far, we haven't seen side effects. I'm really, really pleased with this treatment. And it's the state of the art, is the first of its kind in veterinary medicine. And now they're working to have some for chronic pain and for neoplasia, for cancer as well. So we have a big road ahead of us. This is a treatment available in human medicine for many years now, and it's quite effective for a lot of diseases. So then if we can't cure environmental allergies, so what's the goal? The goal is to provide long-term therapy that is efficacious and safe, right? And that can take time sometimes to work that up. We see our patients on a monthly basis in the beginning while we're trying to figure out what works better for them, and also while we're trying to identify other concurrent issues, such as infections. This is a dog that has allergies. She developed mostly on her lower part of her body, like you're seeing here, with red skin, very itchy, and hair loss. And here we see her after treatment with topical steroids and Cytopoint. She did absolutely wonderful, and she's doing great. Well, how about food allergy? Food allergy is less common than environmental allergies in dogs, but it's also a common issue overall, a common cause of itching in dogs. It can also affect dogs of any age, but more commonly we see in very young dogs, less than 1 year of age, or older dogs at about 7 years of age. It can also affect similar breeds. There's also genetic predisposition, we believe, like in atopic in environmental allergies. But here the problem tends to be more year-round, not seasonal. And you may be wondering, well, can a dog become allergic to something that they just ate? No, they have to have had exposure to that to develop the kind of skin allergies that I'm talking about. So it usually takes months or even years of exposure to a protein or carbohydrate or a food ingredient to become allergic to. The symptoms can be mild or to severe, just like with environmental allergies. But some dogs, about 20% of the dogs that have food allergy, also have decreased appetite, vomiting, and diarrhea. But if they don't have that, it doesn't mean it's not food allergy. If they have it, it's just a more indication for suspicion, along with the skin itching problems. What are they allergic to? They can be allergic to anything, and we know very little about allergies to things that are added in food, like additives and preservatives. Most commonly we know they're allergic to the proteins, and that can be beef, chicken, eggs, fish, lamb, any protein, as long as they have had exposure long term. They can also be allergic to dairy products and also carbs like corn, soy, rice, peas, potato, and so on. They can also be allergic to wheat, which is not included in this list. When you look at them clinically, they can look just like an environmental allergic dog. Sometimes we see chronic changes with both conditions, with environmental and food allergy. Here in the armpit on this dachshund, we have the severe inflammatory reaction with the dark skin and thick skin. The same thing on the tail area of this dog. This thickening and this dark skin, when you see that, that indicates a chronic insult. So constant chewing, licking, or rubbing, or scooting, that can lead to those chronic lesions. And those are harder to manage. Once they become really chronic, it becomes harder to control. So if the clinical signs are similar, then how do we know if the dog has food allergy or environmental allergy? How do we differentiate them? Well, if it's seasonal, it becomes easy, right? Because then I know if the dog just comes with itching just during spring and summer, and fall and winter, the dog is great, then I know this problem is mostly environmental. Now, if it's year-round, it could be either or. And some dogs do have a combination of food and environmental allergies, not the lucky ones. So then what do? We do what we call food trial or elimination diet trial. You probably heard of that. What is that? So that's a test that we do with diet to identify what they're allergic to. But it's very important that you know that skin test, blood test, saliva test, hair allergy test, all those things that you see mainly online for food allergies and even environmental allergies, they're not reliable. We can do blood tests for environmental allergies, but not for food allergies. For environmental allergies, I tend to do when the skin test is not 100% conclusive for the allergy that I'm looking for. So how do we do this food trial? It has to be strict, and it's not fun to do it. It's not fun for us, not fun for our pets, because you have to get rid of all the treats, all the bones, all the things with flavor. So it has to be just a new diet and water. That's how I say it, and maybe some prescription hypoallergenic treats. Which diet to choose is based on each patient. Some owners prefer homemade, which is fine. Often we use prescription diet, and we want to find something that is novel. Let's say if the dog has been eating mostly chicken, maybe I could use lamb. But we can't use a duck diet because duck, if a dog is allergic to chicken, is also going to be allergic to duck. So we have to stay away from any kind of birds. And then often, dogs have been exposed to so many proteins and carbs, so many diets, that often we end up going with hydrolyzed diet. What is that? It's similar to baby formula. The protein's breaking down smaller molecules, and those smaller molecules are now recognized by the immune response, and then you don't have allergens. So those diets are the ones available. One of them is Altamino, the other is Purine AJ. Purine AJ is soy-based, Altamino is feather-based. So those diets are hypoallergenic. I like them better. There's some studies that, although conflicting, show that hydrolyzed diet is better than your novel diet, like a potato and rabbit diet. How long do we do this for? Usually 8 weeks. It can be expensive. These diets are expensive, but it is worth it because if it happens that the dog is allergic to food, we can control their symptoms just by changing their diet. No medications needed long term. How about flea bite allergy? Flea bite allergy in some areas in the US is considered the most common allergic disease. For instance, in Florida, in California. Fortunately, in Minnesota, we don't have a big flea problem, but we can have allergies to fleas. And particularly to the flea saliva, the problem can be seasonal or year-round. It tends to be more of a seasonal problem here. One would think they all die with the freezing weather, but they don't. So they stick around and they can still be an issue. Flea bite allergy can cause allergies in dogs of any age or breed, and dogs with environmental and food allergies are predisposed. So dogs that have allergies already, they should be on a strict flea preventative over time to prevent more sensitivity, because the flea can aggravate their allergy symptoms. Remember that only one flea can induce allergy. And some people say, well, I don't see any fleas in my house. Well, remember that absence of fleas does not mean there are no fleas around. I like to say that they use the dog as a restaurant. They come and feed, and then they hide to lay eggs under carpet and furniture. And of course, if there's no fleas around, they can still be present. And fleas doesn't mean you have a dirty house. If your dog goes to dog parks, they can bring fleas home, and they can be hard to get rid of. So what they look like, these dogs that have flea allergies, they tend to have this rump, this hair loss and sores and scaling and crusting on the second half of their body, like on the back, close to the tail area, the back of the legs, and the belly. So we think more of a flea allergy in those cases, but they can also have symptoms that mimic environmental allergies and food allergies as well. How do we diagnose flea bite allergy? Well, first we look for fleas. We have the suspicion already, right? And then we look for fleas. We may not see fleas, but we may see the flea dirt. So we usually use a cold combing to get rid of those, to try to find the fleas and the flea dirt. But often if we don't see it, we do a treatment trial anyway. We put them on a flea preventative or flea treatment for 6 weeks. Here just shows this dusty black things are fecal material from feces. That's what the flea dirt is. And when you look in the microscope, there's this coma shape. Fun fact, dermatologists probably are the only ones that are interested in knowing what the feces of a flea look like, but it can be very entertaining when we see that in the microscope, particularly with our students. So how do we treat flea allergy? We want to get rid of them from the patient, right, from the animal. And there are many options out there. My recommendation is to always talk to your veterinarian. Don't buy things over the counter if you haven't been using them before, just for safety. Make sure you use what's right for your patient and something of a good brand, reliable, safer brand. There are a lot of options from oral chews. I love the new isoxazolines, we call them, which is NexGard, Brevecto, Credelio, and Simparica. Those are chewables. They're flavored. My dog used to love NexGard. He would sit down for it thinking it was a treat. And I was like, it's just once a month. It's very palatable, so they love it, and you don't feel bad. You don't give it, we're not giving them a medication. You're giving them a preventative to keep them safe, because they're also protecting them against ticks, which is a big problem in Minnesota. You can also use the spot-on products like Frontline, collars like Serasto. And some dogs are so uncomfortable that we need to give them medications such as antihistamines, steroids, Apoquel, Cytopoint during the beginning of the treatment to give them relief. It's also very important to treat everyone in the household, all dogs and cats. They should be on flea and tick preventative year-round anyway, but if they're not, you should treat them. And we want to also do a good vacuuming, dispose bags, clean very well all those areas that they like to hide on a weekly basis, because they will nest in the environment. And then as soon as you're done treating the animal, or if you're not careful with preventative, they'll come right back and you start the cycle again. All right, so let's move now to the topic of parasitic diseases or mange. You probably have heard of mange. We have the most common ones here are sarcoptic mange and Demodex mange in dogs, and also dermatophytosis or ringworm that I want to talk a little bit about. So what is mange? Mange is a skin disease caused by these tiny microscopic mites that fortunately we don't see with naked eye, that can affect the skin of dogs. They're very tiny. Sarcoptic mange is also called scabies. It can occur at any time of the year. Age or breed of dogs can be affected. Usually they're miserable. They have severe itching, and that makes us concerned for sarcoptic mange, although allergies can also cause severe itching. This is a disease that is contagious. They can get it from other dogs. They can get it from wildlife, particularly foxes, raccoons, opossums, so animals that are have exposure to wooded areas or farm areas, they're more likely to get sarcoptic mange. But dogs that go to groomers, dog shows, dogs that are boarded, they're also potentially exposed. We're more suspicious when you have a dog that, let's say a 7-year-old dog, never had skin problems, and all of a sudden start itching really bad. Usually a more acute presentation, then we think of sarcoptic mange. Or maybe they have a history that a few weeks ago, they were at a dog show or an aborted facility or such. So it's a contagious disease among animals. Cats are more resistant to this type of sarcoptic mange. They have their own, and it's not common in the United States, so you don't have to worry about this for cats. So very rarely they're going to get this from dogs. Here we have pictures of the dogs with sarcoptic mange. Very characteristic is this crusty, scaly lesions with hair loss and sometimes bleeding on the margins of the ear flaps. And they can have other signs similar to allergies as well, like hair loss and red skin. Often hocks and elbows. This is a hock of a dog, can be affected as well. And the belly with this papular, this red rash, also suggesting sarcoptic mange. And very concerning that this is a condition that is a zoonotic disease. So it's contagious to humans, and humans get this itchy, very itchy rash as well in their arms or neck, areas that you have contact with the animal. And once you treat the animal, they tend to go away, but people might need to see their physician for relief of itching. How do we diagnose this? It's a very simple diagnose. We scrape the skin. Most dogs don't mind. We do a few several areas, a few scrapings. The problem is the mites are not easy to find. They usually crawl on the surface, and the females burrow into the skin to lay eggs, but they're not easy to find. So we often have to do a treatment trial anyway with a parasiticide if we don't see the mites. But I look for them very carefully, and I want to see them, particularly once I get reaction from the students when we find them. Here we have this little creepy crawling creature. I'm sure some of you are not really excited to watch this, but we have a party in our service when we diagnose these mites, because it's one of the few diseases we can cure. So we can get rid of these mites, and fast. The treatment is usually a parasiticide. In the past, we used to use things like ivermectin for cattle and horses, which tend to have more toxic side effects. But now we use things like NexGard and Bravecto, extra label. They're labeled for fleas and ticks, but then we get 3 for 1. We give NexGard and we treat sarcoptic mange while we're preventing fleas and ticks. If your patient is using those medications for flea and tick, if your pet is using those medications for flea and tick, then you're also protecting them against sarcoptic mange and the other mites that I'm going to talk about. So there's such an important value for using these flea and tick preventatives year-round. You're protecting them not just against flea and tick. You can also use spot-on products like Revolution, and we treat every dog, and the prognosis, as I said, is great because we can cure sarcoptic mange. This is a patient of mine, a 2-year-old dog that came with a long time suffering from itching, very chronic changes. We treated him and he responded very quickly. The owner was very happy. I was very happy to see him back and not itching and comfortable and happy. And he went back to be a happy dog as he should be. But you can see here how severe the changes are in the skin. And he was so chronic. He was being misdiagnosed as a dog with allergies. That's why it's important when you see an itchy dog that we look for parasites before we think of allergies. How about dermatological? That's another type of mange. But what's interesting about this mite is that it normally inhabits the hair follicles and the sebaceous glands. So we also have them normally on our skin, on our noses. I know it's kind of disgusting to think about that, but normally dogs have that. But for something goes wrong with their immune response, they develop this mites growing number and they develop a disease. We believe that there is a genetic predisposition. For example, pugs and bulldogs, they can have Labradors, they can have this condition and they should not be bred, particularly if they develop at a young age. Most cases, most types of Demodex, there's multiple kinds, is usually not associated with itching, but if they have a secondary bacterial yeast infection, they can have itch as well. Fortunately, it's not contagious to other animals or to humans. Usually, if they're develop this condition at a very young age, at about 1 year or less, it's usually good. We can resolve it faster and they do better, versus dogs that are older than 4 years old, for example. The prognosis is more reserved because if they have an underlying disease like cancer or a hormonal disease like Cushing's or hypothyroidism, it can be harder to treat unless you address the underlying cause. Fortunately, there are some old dogs that have this condition without having any underlying disease, which is wonderful, and we can still treat successfully. How do we recognize this condition? It's usually hair loss and can be localized, like you see in this picture here, by the eye, can be on the neck only, like in this area, can be anywhere on the body, but it tends to be like a kind of a circular round or even diffuse area of hair loss without inflammation, but sometimes it becomes very inflamed and they attract bacteria and yeast, and then the skin oozes and becomes very painful as well. So it can be mild to severe. This is a severe case on a pug with severe dermatological, complete hair loss, very chronic. You can see the skin is very dark. Fortunately, this dog had a full recovery. How do we diagnose? We look for the mites. We do this skin scrapings again. And fortunately, these mites are easy to find if the scrapings are done correctly. There are these little guys here that look like a cigar type of has a cigar shape. If we identify them in a localized lesion, right, just one lesion in a young dog and a puppy, the good news is that about 90% of them can spontaneously resolve. So then it goes away. But if you can do just monitoring, you don't need to do anything. You may use benzoyl peroxide shampoo or gel that we may recommend, but typically we just monitor to make sure it's not becoming generalized. And in all those cases, in a young dog or older dog, we have to treat. And again, we used to treat this with Ivomac, an insecticide, or Amitraz bath, which was very hard to do. But now we have medications like NexGard, Bravecto, Simparica, and Credelio that can be used easily as also flea and tick preventative. And we use the same schedule, the same dosage, very easy. If it's a young dog, we need to make sure they have a good diet, they're vaccinated, they're dewormed, to make sure your immune response can be focusing on the mites only. And if it's an older dog with an underlying disease, if possible, we need to treat that. This is a patient we saw not long ago in our hospital with localized severe dermatitis with secondary infection. A month after treatment, significant improvement, and now he's doing very well and very happy, as he should be. And then we have ringworm or dermatophytosis, which is not a mite, is a fungal. Most commonly we see Microsporum canis as this species. It's more commonly seen in puppies. Usually it's not itchy, although it can be. And unfortunately, it can be transmitted from cats, rodents, or the environment. That's how they get these fungal organisms. Usually you see these round lesions that can look like Demodex mites, lesions with round circular. This is a little chihuahua. I love this picture on his butt with a little local lesion. Here on the muzzle, these are very common areas of contact with the ground or with other animals, but it can also be generalized. They can lose all their hair and have scaling and crust all over. They can also have secondary infections. We look for the diagnose, we look for spores and abnormal hairs like in this picture, and often we do a fungal culture for diagnosis. That can take up to 3 weeks to know for sure what kind of organism they have and where they got it from. It is a contagious disease to humans and to other animals and cats and dogs. So we want to make sure if somebody develops that they see their physician for care and treatment as well. We treat with topical antifungals, sometimes oral antifungals. We treat everyone in the household, and we often use bleach for the environment or even products that are like Clorox to clean the areas that are possible. If the patient is in a good health status, the prognosis is usually good. It just can take a long time sometimes to resolve. Last, we have secondary infections. What are they? They are the bacterial and yeast infections that we see with many skin and ear diseases. That's very common. Bacteria and yeast are part of the normal flora, so we have them on our body. Dogs have them on their body. And when something goes wrong, allergies, for example, you can have these infections, making things worse. So it can cause itching on a dog that doesn't have itching, like a dog with hypothyroidism, or increase itching in a dog that is already itchy, like an allergic dog or a dog with mange. When we think of bacterial skin infection, we think of pimple-like lesions, like acne-looking lesions. They're pustules and papules, like here on the groin of this dog. They can also be seen with this moth-eaten, this little areas of hair loss all over the body, sometimes associated with scaling and pigmentation, like in this dog. And here, a kind of a mixture of all those kind of lesions. So that's often suspected to be a bacterial skin infection. Here we have a dog with skin infection associated with yeast. You see like this chronic changes, again, thickened and black skin, and yeast love those areas, particularly if there's oily skin and moist. The paws of dogs tend to be commonly affected with this brown debris. When we see that associated with inflammation, we also think of yeast. Nails, discolored nails with brown debris, we also think of yeast. And folds, they love the folds, tail folds, facial folds on those cute breeds that have those folds with this brown debris and redness. And they can be itching and rubbing their face. And when you look at their folds, you find the problem. Well, this is an allergic pug with chronic yeast infection. This dog came to me with this recurrent problem, chronic ongoing issue. He was covered in yeast. There was even some bacteria as well. And this dog had received Apoquel, cytopoint, steroid, and nothing was helping this dog significantly because the skin infection was not being treated. Once we treated the skin infection and the chronic changes that we saw, we're able to effectively control the allergies and prevent this from happening again. So it's very important to address the secondary infections that make the problems of allergies and itching being perpetuated. We diagnose them very simply with skin impression, with a slide or a tape that we use, a tape prep, a transparent tape. So it's what we call skin cytology. And we can also see then the bacteria, like here inside this white blood cells, in the yeast here, this footprint looking things. And sometimes we need a bacterial culture, particularly if we're concerned with bacterial resistance and we need to select a specific antibiotic. When you think of bacterial skin infection, we no longer give antibiotic to all of them. It's very important to remember that we are living at times of bacterial resistance, not only in human medicine, but also in veterinary medicine. So we're staying away from antibiotics orally or injectably if we can. So we're going to start first with topical therapy. I know it's more work, but it's worth it. Doing shampoos and mousses and wipes, antimicrobial creams and ointments. And that can be very efficacious in many cases. If that's not helping, then we enter with oral antibiotics and antifungals. We need to remember that these should be left as last resort because of resistance, but also side effects. These are not 100% tolerated, right? They can cause upset stomach. They don't want to eat. They vomit. Convenient injection can be very potent antibiotics. So we want to use that only in cases that are absolutely necessary. And we see these patients until we get rid of this infection. And usually we treat until 1 to 2 weeks after we don't see any lesions left. This is my beautiful patient, Daisy. She has allergies, environmental allergies, and she was seen with infection on her face, on her ears, on her skin. We treat her topically, and she did wonderful. She was still itching, but later we prescribed allergy medications, and she's doing well. She even got whiter with all the baths that she was getting to clear the infection. Ear infections can be caused, commonly seen as well. It can be seen in dogs of any age or sex, any breed. However, we tend to see more commonly in those dogs with beautiful long ears, like Cocker Spaniels, English Springer Spaniels, Basset Hounds, and those hairy poodle ears also are commonly predisposed. But often they have an underlying cause. It can be a plant material, debris accumulated in the ear, a mass. But the most common cause of ear infections in dogs that can infect one or both ears is allergies. So we see a lot of dogs with allergies with ear infections. What do they present for? They may be having stinky ears, like the owners say, sensitive, painful ears. They may be itching, scratching, rubbing, and they may be shaking their head. They sometimes can have neurological signs too, with head tilt, disorientation, because of severe, deeper ear infection. These are dogs with inflammation on their ears because of ear infection. Here we have a more chronic case associated with yeast, with that brown discharge again. But chronic, look at the thickening of the skin and the blackness with very thickened folds too, starts closing the canal and then becomes harder to treat. Here we have a Pseudomonas bacteria infection, a nasty infection that causes a lot of pain and open sores in the ear. And here a case of more chronic with what we call cauliflower ear. The canal is getting closed and it's harder to treat. We diagnose with ear cytology, so we do swabs, we do culture if needed, and very important is that we identify what's causing it, that we don't focus just on the bacteria and the yeast. We need to find out why my dog is having these ear infections. We often use CT scan for those chronic cases to look for masses, to look for middle ear infection, and we often do a videotoscope and flushing to really go in there and remove all that debris that you are unable to do it at home. Appropriate ear cleaning is very important. What kind of ear cleaning you should use? If it's a dog that has ear problems, should be recommended by the vet according to the infection. We often use the steroid drops along with antimicrobials. And remember, some of these cases can take several weeks to even months to resolve. And we do treat until 1 week after we don't see anything on the ear cytology. How do we recommend ear cleaning? The canal is very long, so you have to make sure that you put the liquid in the canal instead of just wiping the outside like in this picture is showing, and massage the base of the ear, avoiding Q-tip and cotton balls because of potential trauma. When nothing works, when you have a dog, particularly Cocker Spaniels and English Springer Spaniels, they're prone to these chronic cases that the ears look like that. That's what we call end-stage otitis or cauliflower ear. And you're trying to put topicals in there, it's not getting anywhere. That's time for what we call surgery, total ear canal ablation, or TICA. So a board-certified surgeon will go in there, remove the canal, get rid of that nasty stuff, and then the dog keeps the ear flap and just has no ear canal. So no more topicals, and the quality of life improves significantly. Dogs can be very stoic, they may not show that they're uncomfortable, but ear infections are painful. And they're often recurrent problems. So again, it's very important to remember that the ear infections and the skin infections are just the tip of the iceberg, that they're underneath. There's a lot of things that need to be investigated and treated. So we have to be like detectives to find out why and manage that, so then we prevent this recurrent ongoing issue with skin and ear infections. So my goal for a lot of my patients is not to cure them, because a lot of diseases are not curable. If I can cure, is wonderful, but if I can't, I wanted to give them a good quality of life. I wanted them happy. And if they're happy, their owners are going to be happy. Their family are going to be happy. This is Willie. He suffered with allergies at a very young age, and we were able to give him a good quality of life. So once I give them a good quality of life, then the follow-up visits are just fun. I get to have some sitting around, selfies and kisses. Right now I have them all for myself because the owners are waiting in the car. So it's not as good, because I love to see the clients, but at the same time, we get to bond even more. We have some research. If you guys are interested, dogs with allergies, pyoderma, and seborrhea, you can look into our website, and also one for treatment to reduce itching in dogs with environmental allergies. Our principal investigator is Dr. Torres. If you want to go into the website and click I'm interested, and you can get more information. Well, I end here. I always talk more than I want to, but we do have this picture of our dermatology team, our lovely nurses and doctors, and I could not do what I do without them. Thank you so much. I think we have some time for questions.
We do. Thank you so much, Dr. Koch, for your great presentation. There's so much to learn about skin diseases, and having this foundation is so very helpful. If you're ready, I think we'll jump into some questions from the attendees.
Great.
Perfect. The first one we have is, do allergies change as the dog ages, and can a pet grow out of allergic reactions?
That's a great question. Yes, allergies can change over time. They tend, actually, unfortunately, this is not good news, but they tend to get worse. They start mild and they can become severe. They start without any infections, without ear problems, and they can start having ear problems. They may not chew their paws at first, and then they start chewing. So the symptoms change, the severity changes. It's very unlikely that they're going to outgrow it. So if once they have allergies, they need whatever treatment that works and that is safe for life. Sometimes there are dogs on immunotherapy after allergy testing that are able to have discontinuation of treatment like people, but it's not common.
Sorry, I'll unmute myself. We had a lot of questions about what causes dogs to lick their paws constantly. You touched on this a little bit in your presentation. Some people kind of remarked that they noticed red or pink spores between their dog's pads and toes, where others notice those physical signs. Can you explain some of the most common reasons a dog might frequently lick their paws and what treatments may exist?
So allergies is a common cause of the licking of the paws, particularly if it's more than one paw. Anxiety can also cause that, but usually doesn't cause a typical redness and hair loss in between the toes and pads. It's more just on top. They can also be licking their paws because of pain, particularly if in the areas that they may have arthritis. They may also lick because of mites, like I talked about, because of secondary infections. Maybe it's just one paw. It could be a foreign body, a plant material that is there. It could be a tumor. So there are many, many potential causes, but the most common by far is allergies.
Thank you. Are there any new alternatives to medications like Apoquel, Cytopoint, or steroid treatments? And should they be concerned about leaving their pet on a medication like this for many years?
That's a wonderful question. Unfortunately, we don't have anything new yet. Things might be coming up on the pipeline in research. However, for now, that's what we got. And believe me, it's much better than it was a long time ago when I was a resident, even as a vet student and doctor. I had only steroids and antihistamines. So now we have many more options to help your pets. And they are more targeted, as I said, they're better therapies. And if the animal is tolerating, if the animal doesn't have contraindications to have those medications, and we monitor them closely with lab work and follow-up visits, they can stay on those medications for life. And we need to think about it too, the pros and cons, right? The allergies itself, itching, causes so much discomfort, affects their quality of life so much that we need to think about the benefits, the cost benefit of those medications. And with careful monitoring, they do really well. We just need to choose the right treatment for the right patient.
Thank you. Talking about food a little bit, do you advise rotating proteins for dog foods or for dogs with food allergies, such as a bag of kibble with beef and then maybe the next one with salmon, etc.?
I would recommend not, if a patient is food allergic, the right thing to do is use a prescription diet or work with the vet to identify an over-the-counter diet that would be feasible, that would be safe for that patient with allergies and not induce itching. Changing diets can be a concern, and they can develop allergies to that food again, and then you're into a problem. Also, changing diets all the time if they're not food allergic makes it harder for us to choose a diet if they become food allergic. Also, there's cross-contaminations in factories. So if you're saying, oh, I'm changing the diet to salmon, and the dog is eating chicken, the diet with salmon may have traces of chicken because in the factories, they do use the same, they don't clean it up, and there is contamination with different traces of different things that there's not in the label. So we need to be very careful. We don't use over-the-counter diet for food trials for that reason.
So now as we're kind of hopefully moving into some warmer weather, what should we know about allowing dogs with thick, long coats to swim in lakes?
They should swim, right? How do you keep a lab or a golden or a German Shepherd out of the waters? We want to swim too, right? They should swim. They should enjoy. If they're healthy, you should not worry about it, right? But if they're allergic, that's more concerning. And what we recommend is hose them down with water. And you can do this for your healthy dogs too. But for your allergic dogs, lake water can be a problem because their skin is moist and then there's pollens and contaminants. So hosing them down with water after being in the lake for a day and sometimes using medicated shampoos can help. But they should not stay away from the water. They need to enjoy and have fun.
Got it. Thank you. So this person asks about their dog has developed many different looking types of skin growths. How can you tell which ones they need to be concerned about?
Because there are skin growths that look benign and are malignant and bad tumors, and others that look bad but are good, I suggest that every time there are concerns for skin growths that you bring your pet to the veterinarian. Those lesions can be evaluated and often sampled to bring peace of mind that they're benign. So it's hard to tell just based on appearance if you don't have experience in recognizing them.
Thank you. The next question is, related to dry skin. So, do you have any tips for how to best manage dry skin using food, shampoos, medications, or something else?
That's a good question. It's important to know that your dog may have dry skin for not a specific reason. Maybe it's just the cold weather and being indoors and with heat. However, there might be an underlying disease, or might be a completely different condition than just seborrhea, than just dry skin. So depending on the situation, it might be good to have the dog evaluated. But if it's just your typical seborrhea dry skin, mild shampoos with conditioners is good. You can even use Johnson & Johnson shampoo, baby shampoo, which is fine. You can also have over-the-counter and prescription anti-seborrhea shampoo that can be used, that have fancy things like ceramides and lipids or oils that can help the skin. You can even put oils on the skin, like Johnson & Johnson oil to help, and just be prepared for the mess. Fish oil is omega-3 and 6 fatty acids, can also be very helpful for dry skin.
Perfect. Thank you. I think we have time for about one more question. And this one could be around bathing. Is more or less bathing good or bad for skin issues? What's the right balance? And should I look for or avoid any ingredients in a dog shampoo?
That's a very important question too. Our patients, particularly those with allergies or that are prone to infections, we recommend baths forever. Regular baths, usually once weekly or more often even. I know it can be a lot of work, but can make a huge difference. You can remove the allergens from the skin, right? If they have pollens and mites on their skin, you can remove that. You can also control itching, soothe the skin. You can also treat secondary infections. The type of shampoo is going to really depend on the type of skin problem. Dogs that are healthy, that have healthy skin, don't need anything special, don't need frequent baths. They can be bathed as needed.
Thank you so much.
Is that it? This is so much fun.
That's going to be it. Thank you. So thank you to Dr. Koch for your presentation and your insights tonight. And thank you to our many participants that shared such thoughtful questions in advance and during the presentation. As always, the Veterinary Medical Center is here for you 24/7 to help care for your pet. Please don't hesitate to reach out to us. Next month, the VMC Animal Health Education Series will welcome Dr. Anna Frischman, whose presentation titled "The Remarkable Athletic Capacity of the Horse" will describe how the horse's cardiovascular and respiratory systems function during exercise and adapt with training, and how their performance is sometimes affected by the problems in these areas. If you enjoyed learning about our team's work tonight, we encourage you to visit our website or reach out to us directly to learn more about our mission to improve the health and well-being of animals and people. We hope you will consider supporting our team and the work we do to serve animals of all shapes and sizes. Thank you again for attending tonight, and we hope to see you next month. Thank you.
Thank you.